It is indeed historic in its combination of higher premiums, higher taxes, Medicare cuts, and more federal government debt. Millions of Americans, if it were to pass, will be forced into government plans when their employers stop offering health care plans. As a former governor of Tennessee, I simply do not see how Tennessee can pay for its part of the Medicaid expansion without imposing a new state income tax and damaging higher education, or both. Health care reform, Mr. President, is supposed to be about reducing costs, not increasing costs. So, Mr. President, why, instead of this 2,000-page bill that raises in premiums, raises costs, cuts Medicare, increases the debt, why don't we start step by step to reduce costs? I was privileged to attend the White House Fiscal Responsibility Summit in February. The President invited me. I was glad to go. He talked then about what is obvious about our country's fiscal situation and said that putting America on a sustainable fiscal course, and I'm quoting, will require addressing health care. Then at the President's White House Health Reform Summit in March, the President himself introduced the B word, the bankruptcy word, which I'm beginning to hear more and more about as these bills come toward us. The President said, if we don't address costs, I don't care how heartfelt our efforts are, we'll not get this done. If people think we can simply take everybody who's not insured and load them up in a system where costs are out of control, it's not going to happen. This is President Obama talking in March. We will run out of money. The federal government will be bankrupt. State governments will be bankrupt. Well, Mr. President, that's the B word. That's our president talking. And I think we should listen to those words and the repeated warning from careful advisors that the costs of these health care proposals is going to head us in a state of fiscal ruin. Let's read this bill, let's know what it costs, and let's see how it affects you.